disclaimers. Veterinarians are not scamming you when they recommend diagnostics. We are required to offer it. We can get sued if we do not work up a case appropriately. Comes in for vomiting and diarrhea, let's say. It could be something so simple. Bad batch of food, little tummy upset, ate something in the yard, ate some grass. It doesn't matter. Something so small. Stress colitis from boarding, going to a lake and drinking some crappy water. Like, it's so minimal, but it can also be so severe. Severe pancreatitis, severe obstruction in like a foreign body. So many causes of vomiting and diarrhea. It's insane. Your animal can't talk. They can't even tell us what they did. We just have your history. We don't watch them 24/7 a day. So when we're recommending diagnostics, it's to rule out the bad things. The things that need surgery, need hospitalization. We cannot do that without x-rays, blood work, fecal tests. Offer those to be thorough and to not miss important things. It is completely fine if you want to decline those. I have conversations with this all day, every day. I'm like, listen, your dog doesn't have a fever. He seems okay. He's pretty bright and alert. He's hydrated. You don't want to spend the money on the diagnostics. You think it's probably just something he ate. You're not worried. I'm not too concerned. We make a mutual decision. You're like, we're going to wait on the diagnostics. We're just going to treat supportively and then revisit with diagnostics if we need to. Cool. I'm so happy to do that. I'm so happy to help you with that. I'm thrilled. But us saying, hey, it would be a good idea to check some blood work and x-rays, that's what I would recommend, is not me being scammy. I'm not trying to make $700 off of your dog with a little minor tummy upset. I'm not. One, I'm protecting my license. I have to, because if I don't offer it, and let's say it was something severe and your dog declined or got worse or died, that would be on me. No, it shouldn't necessarily be on me, but it is, because I didn't offer you the highest standard, gold standard treatment. So your vets are not pushing that stuff to like make a buck. I mean, I know it feels that way, particularly probably in like big cities, corporate practices. I know the cost of medicine is rising severely, and like that is very frustrating. And I feel for you guys because I feel for it in my own pets. Like, if I was not a vet, my dogs would not have the care that they have because I would not be able to afford it. But we're not recommending that stuff to scam you. We're recommending that stuff because it's the highest quality medicine and is the best practice to offer it. When you're really sick and you go to a human ER, they just run all this stuff and then it gets billed to insurance and you deal with it later. Your doctor's not like, oh, we're not going to run all these tests because it's going to cost too much. They just run it because they want to check. And especially when you think about like children, the elderly, the immunocompromised, there's cases like that where it's really, really important to find out the exact cause very, very quickly. And you can't do that without diagnostics. You're just treating based on assumption. And yes, we have very well educated guesses, but we don't always know.